What's up, guys? I'm David Hinden. I am a trauma surgeon and a YouTuber, and today we're going to be reacting to more videos by the hilarious Dr. Glaucomflecken. Let's go. Oh, God. The med student.
Good morning.
So, just to paint the picture for everyone, I can't tell you the number of times when I was in med school and then in residency that the patient is intubated, everybody is ready to start, the entire team is in the room except for the surgical attending. So this is a very real dynamic in some places where the attending breezes in late, everyone's been waiting, and it's time to start the case. I make sure to never be that guy.
Everyone, sorry I'm late. What? What's the problem? Did you just apologize? What? No, of course not. I would never apologize. You did. You said you're sorry. We all heard it. Yeah, that was clearly an apology. Well, that was an accident. I take it back. No, it's too late. You already expressed remorse. Well, of course, I didn't mean it. That was a fake apology. No. I have fake apologized hundreds of times. That was a real apology. And I've real apologized thousands of times. It sounded real. Hey, dude, you want to take a break? Not right now.
This is great. The break dynamic is actually real. So in the practice of anesthesia, at least in the United States, there is a tradition where the provider that's at the bedside during the surgery providing anesthesia gets breaks and gets swapped out because you want to really be careful that this person is staying sharp and avoiding any fatigue and able to sort of catch things as they're unfolding.
The surgeon just apologized for something that was his fault. Oh, for real? You mind if I stick around? This is ridiculous. Surgeons apologize all the time. It's been 12 years. We keep track.
Oh, God.
Hey, what's going on? Oh, your surgeon just said he was sorry for something he did wrong. What? Oh.
I love his versions of the intubated patient. So in reality, once patients are intubated, they are not communicating during surgery. They're not making faces and talking, certainly. But his intubated patients are amazing.
It has nothing to do with your surgery. He just admitted that he, cares for the feelings of others. Oh, nice. Well, I didn't even have to say I was sorry. Surgeons don't need to apologize. Other surgeons apologize. No, they don't. Yes, they do. Hey, ortho. Hey, what up, charge bro? Have you ever apologized? Oh, yeah, I apologize every time I admit a patient to medicine. I'm on 8 apologies today. Okay, this is silly. You're all blowing this out of proportion. Hello, General Surgery. I'm the CEO of the hospital. I heard about your apology this morning, and I just want to say what you have done for staff morale.
Oh, my God.
It's more than we could do with 1,000 wellness modules. Oh, come on. Please accept this award on behalf of the entire hospital and humanity.
Oh my gosh, it's amazing. I love that they have a certificate of achievement for the surgeon who's apologized. All right, time for another. So this kills me. He is obviously scrubbing, as you can tell. He's got like the little scrub brush and you hear like the sink, but he's still wearing his white coat. You cannot scrub with your white coat because you can't operate in your white coat. It's not sterile and you can't like push your sleeves up. So I just can't wait to see what he does next. All right, this guy's major attending vibes. Casual slides in there. He's not wearing his white coat to scrub. He's got the loops on.
Hello. So, do you scrub here often? Do you have like a favorite sink or what?
It's so awkward being a med student, and he captures this just perfectly in all these videos. You feel like you're standing side to side with this attending for a couple minutes. It feels like you're sharing this moment and you should be talking. But in reality, unless the attending's like chatting you up, it can be kind of awkward to really start conversation.
How long do you think it would take to scrub our entire bodies at this rate? I feel like we should be singing something right now.
Oh my God.
Do you want me to sing something? Like next time, if you want, we could scrub each other's hands. Working 9 to 5, what a way to make a living. Ophthalmology, When I scrub, I like to pretend my hands are made of scratch-off lottery tickets.
And then I win and pay off my student loans. You know, my essential trimmer just really makes scrubbing effortless. Scrubbing decreases the risk of infection by 92%. It also increases the risk of making a best friend by 100%. You know, you should probably scrub up to your shoulders just in case your muscles blow your sleeves off. Fun fact, I finished scrubbing several minutes ago, but I'm afraid if I finish before you, you're going to think I didn't wash my hands well enough, and then you'll give me a bad grade, and I won't get to be a doctor.
That's true. There's a definite feeling that when you're scrubbing and you are the med student, or frankly, even like when you're a junior resident, if you're standing next to the attending at the scrub sink, it kind of feels like it's going to look bad if you finish before them. Like maybe you didn't scrub well enough if like you're so good that you scrub faster than the attending. So that's kind of a real thing.
You know, it's really been great talking with you. I'm going to pretend to scrub for another 30 seconds so I finish after you, but not so late that you're wondering what's wrong with me. You're still wearing your white coat.
Ah, you caught it.
Oh, man.
All right, let's watch another one. It is hard sometimes when you're not in your home base in the hospital to find a computer that you can like look stuff up on. So he has just made the tantalizing discovery of a spare computer with Epic already logged in. And you can see he's trying to decide whether or not to do that while he's like vulnerable in the ER.
Surgery, how's it going? Hi, emergency. Just finishing up here, about to head home. How was your night? Busy. How's life? Everything going well?
The pain is tangible. Like you can feel a consult is coming. And in reality, being mean or like hiding from the ER doesn't prevent the consult, but there's this like feeling that you bring it on yourself if you hang out there too much.
Life's good, thanks. How about your family? Everybody good? Well, actually, my oldest daughter... Hey, that's great. Hey, while you're here, can you lay eyes on room 10 for me?
Oh, no.
You want me to lay eyes on a patient? Yeah, you know, look at the patient, examine them, evaluate the imaging findings, determine if surgery is needed, and if not, discharge the patient, accepting all liability.
So there's this phenomena when other specialties curbside each other, and it's considered curbsiding, or you call it curbsiding because it's meant to feel more casual than a formal consult. And if it seems like a dumb question or something sort of minor, there's this sense that, hey, if I just curbside this other specialty, it's less work for them. It's not as big a deal. They can just give me the quick answer. It's probably an easy question anyway. But the reality is, if somebody else is weighing in on the care of your patient, that's a big deal. Like they have to actually know what's going on. They need to really be pretty thorough about looking through the chart and looking through all the findings, because if someone just sort of gives an off-the-cuff answer, that becomes the actual care that the patient receives. So not only is there a liability sense for doctors, but much more important, there's a real implication that the care may not be correct if someone just gives a quick answer without all the info. Anyway, let's keep going.
You want a consult? No. Just lay eyes and hands. Drop a note, just while you're here, you know. No. You can call a consult. But we established rapport. I asked you about your family. We're friends now. You won't do me this favor? Hey, look, a patient who could use point-of-care ultrasound.
ER docs are amazing at ultrasound, and as a result, they kind of use ultrasound a lot because they're so good at it. So it's kind of become like a running joke in the medical world that they use ultrasound for everything.
Before you go, can you just look at this CT real quick? You mind if I just put your name in the chart because we had this conversation? No, just call a full consult. Hey, could you take a look at this kid for me real quick? Come on, surgery. Give us off-the-record medical advice so we can sleep at night. No, why would I do that? Because you chose to chart in the emergency department.
You charted.
You chart here. You work here. I'm not your employee. I don't work for you. Are you sure about that? What? We're
This is so good.
so happy to have you. You'll love it here. Rampant burnout, complete lack of respect. I don't want to do this. It's already done. Welcome to the team. Trauma surgery.
Oh no, the Diet Coke. All right, time for another.
Ah, hello, Bill. It's good to see you. It's been a while. Oh, hi. You look a little less disheveled than usual. Oh, yeah. I had
I'm guessing this is a med student that started fourth year, but we'll see.
time to take a bath this week. Ah. Well, are you taking care of your mental health? I guess. You know, mental health is important during the winter, especially when it gets dark so early. We can't all enjoy it as much as radiology. Yeah.
I have never, ever been in a radiology reading room with the lights on. It is always dark and kind of looks like that. It's actually pretty spot on.
Winter's pretty tough. Are you getting any sunlight? That will help. Actually, yeah, the hospital wellness program has mandated that all residents and med students get 10 minutes of sunlight every day. Well, that's wonderful news.
That actually would be a good thing. There are times in residency and in med school where you are arriving at the hospital before the sun comes up, leaving well after the sun's gone down, and unless you're hanging out by the window, really don't see much sunlight.
I was just about to go get my sunshine break. Do you mind if I join you? Oh, sure. Come with me. Here we are.
Oh. Oh no.
Bill, this is a windowless room. No, it's not. See?
Oh no. I have literally been in a hospital where the wellness team at the hospital thinks that they're going to help cheer up morale by putting a sign over the sink telling employees to give themselves a pat in the back. I'm not exaggerating, so this is crazy, but it's not that much of a stretch of the imagination.
This one's my favorite. Bill, what is this? This is wellness. I'm getting well. This isn't wellness. You need actual sunlight. Well, the administration said that this and individual saltine packets are all we need. Besides, we like it here. Wait, what do you mean by we?
These are so good. I could watch these all day. If you like this video, click here to subscribe and click here to see more videos. I'll see you soon.